From WXII 12 News, this is breaking news.
There are 6 new cases of coronavirus in the Piedmont Triad tonight at least, and more than 100 reported cases throughout North Carolina. 3 of those new Triad cases are in Forsyth County alone. There are also 2 new cases in Guilford County, bringing the total there to 3. Davidson County tonight is also reporting its first case. There are now a total of 9 here locally, and there are at least 119 confirmed statewide. The health department reported 97 cases when we woke up this morning. That number has gone up since then. One of those cases is in the state's first community spread case. That person lives in Wilson County. Here's what the term community spread means.
We have at least one case where we don't know how someone contracted COVID-19. They didn't have contact with someone who tested positive for COVID-19, or they didn't travel to a highly impacted area.
Dr. Mandy Cohen says the state did prepare for this. She says this confirmed case moves the state into the mitigation phase when reducing people's exposure becomes even more critical than it was prior. And there are 5 new cases of coronavirus in the Piedmont Triad, 3 in Forsyth County, as we mentioned. Leanne Denyer spoke with the county's public health director earlier today. Leanne, good evening. What did he say to you?
Forsyth County has seen 5 cases of presumed positive COVID-19, and the health director said today that 1 person has recovered. He shared an update this afternoon before the Forsyth County Board of Commissioners meeting. He spoke to a pretty full house, of course, observing those distance suggestions inside the meeting. He mentioned that the health department has put a person in place who's the direct contact between these long-term care facilities and the health department. That person is facilitating questions that might arise between those 2 groups. We also were reminded that there is a COVID-19 hotline that folks can call with their questions. Overall, he said he's really proud of the work that he's seeing as people observe the guidelines and the suggestions to help try to limit the potential exposure. And take a listen to what he had to say.
You have individuals in 2 camps, people that are overreacting with anxiety, and then you have individuals that are probably underreacting. And we're wanting people to be in the middle, which is to be proactive, take a measured response, and practice those basic practices that we've been telling people to do as far as the good hand hygiene and to staying home when they're sick.
So some good tips there. Swift says that if you think that perhaps you've come into contact with someone who could be a carrier of the virus, he says go ahead and self-quarantine. Keep yourself away from friends and family and practice that social distancing, as well as monitor for symptoms. That's the cough, fever, or the trouble breathing. He says monitor for your symptoms, and if anything arises, call your primary care physician as soon as possible. In Winston-Salem, Leanne Denyer, WXII 12 News.
Good information, Leanne. Thank you very much. There are 4 other confirmed COVID-19 cases as of tonight in the Piedmont Triad, and today we learned about 2 new ones in Guilford County, as well as the first in Davidson County. The health director says the person in Davidson traveled outside of North Carolina, but somewhere within the United States. The Guilford County Health Department says one of the cases involved a person who recently traveled to Florida with family. The other person went to New York State. Experts say COVID-19 will continue to spread, but the question is how many additional cases will we see here locally? Dr. Christopher Ohl says social distancing and the time that we have had to prepare should slow things down, and we hope it slows it down significantly. Kirsten Gutierrez sat down with the doctor today. He explains how this virus is transmitted and when someone should get a test.
Dr. Ohl says the number of confirmed cases of the coronavirus will likely double in the next week or 2. He says they're testing more, and with more tests, there will be more cases. With more cases predicted to follow, Ohl wants to remind people to stay calm. He says the statistics of surviving COVID-19 are good.
So 85% of people still, that number hasn't changed. They're going to be fine. It's a mild to moderate illness. You can stay home. And it's nothing to worry about. We've been saying that all along. It's like having the flu.
He says with people practicing social distancing and other restrictions, it should help contain the outbreak.
And if we can get the virus transmission slowed down enough, it will make a difference.
When it comes to contracting the virus, Dr. Ohl wants to make something clear.
The virus is transmitted from a person who has the infection to a person who doesn't. or it gets transmitted from a surface that the person has an infection, has got their cough droplets or something else on. Those cough droplets really are a problem only for a while. And it depends on the surface, but it can be anywhere from a few hours to maybe a day or two. If you clean that surface, soap and water, any disinfectant, Lysol, it's gone. It's dead.
He says the infection does not spread through a contact of a contact of a contact.
So let me explain. If there's a COVID-19 patient and one of their family members goes to, let's say, a school before we shut the schools down, and then one of those school people go to another place, and one of those people go to another place, but they're all fine, that does not expose you to COVID-19. You are exposed really only being around an exposed person.
Oles says most people who are capable of transmitting the virus already have symptoms, but they can be mild. During allergy season, it might be hard to differentiate, but he says one thing is a telltale sign you might want to get tested.
Because a big component of COVID-19 is fever. 85% of people now, if you put all the studies together, have a fever. Allergies don't give you a fever.
Oles says if you do not have a fever or cough, you do not need a test. When asked how long this pandemic would last, Dr. Oles predicts longer than 2 weeks, but shorter than 3 months. He says we probably won't feel normal again until midsummer. In Winston-Salem, Kirsten Gutierrez, WXI 12 News.
Midsummer. All right, Kirsten, thank you very much. Dr. Oles answered a number of questions today and said the situation is kind of like waiting for a hurricane to come ashore. You can watch his full interview right now on the WXI 12 News Facebook page. Just click on the video tab. And we have breaking news. Starting tomorrow at noon, Novant Health is no longer allowing visitors into acute care facilities. That includes a number of hospitals throughout the state of North Carolina. They are making exception for mothers in labor and minors. Those visitors need to be healthy and they need to be at least 13. Screening will start at the door, again, starting tomorrow at noon. Sadly, there still is not a vaccine or cure for coronavirus. President Trump, however, says drugs used to treat malaria and severe arthritis could be an option to slow or even treat COVID-19. The FDA approved those drugs being used in a clinical trial right now. President Trump also says other antiviral medications will be fast-tracked for FDA approval. Meanwhile, there are tents set up outside of some clinics in Winston-Salem and Greensboro for drive-through testing. Novant and Cone Health are asking people who think they need to be tested to call their doctor first. Then the doctor will decide if they in fact need to come to one of these drive-through testing areas. You cannot get a test without a referral. President Trump has signed a $100 billion coronavirus aid package, which will help people get free tests. This also includes money for emergency paid leave, among other things. A secret recording of U.S. Senator Richard Burr of North Carolina warning business leaders about the coronavirus during a private meeting is out tonight. That meeting was just a few weeks ago, and many people are asking why he didn't share his concerns with the public sooner. Bill O'Neill reports.
Senator Burr, the chairman of the Senate Intelligence Committee, met 3 weeks ago with a private business group called the Tar Heel Circle. It's made up of some of the senator's biggest contributors, including his hometown company, Reynolds American. According to NPR, someone attending the luncheon in Washington became so startled by the senator's warning about the coronavirus, they started secretly recording it.
There's one thing that I can tell you about this. It is much more aggressive in its transmission than anything that we have seen in recent history. It's probably more akin to the 1918 pandemic.
The 1918 pandemic Senator Burr is referring to is better known as the Spanish flu. The CDC estimates it killed 50 million people worldwide. This message from North Carolina's senior senator to a private audience was much stronger than the message most Americans heard at that time. It wasn't a message he shared with constituents back home. 13 days after the senator's speech, the State Department warned Americans about travel to Europe. And 15 days later, the Trump administration banned European travelers from entering the U.S.
Every company should be cognizant of the fact that you may have to alter your travel. You may have to look at your employees and judge whether the trip they're making to Europe is essential or whether it can be done on video conferencing. Why risk it?
The senator's closed-door speech came more than 2 weeks before North Carolina schools closed down because of the coronavirus threat, and roughly a week before the state recorded its first case. Senator Burr's warning 3 weeks ago contradicted the message President Trump was putting out at the time. While Senator Burr was speaking to the Tar Heel Circle, the president said this about the virus, quote, "It's going to disappear. It's like a miracle. It will disappear." Now, the president has since changed his position on COVID-19. We today reached out to Senator Burr's office for comment on this story. No one from his staff has returned our call. In Greensboro, I'm Bill O'Neill, WXII 12 News.
Well, a number of local businesses are making big changes in hopes of keeping the coronavirus from spreading. The governor told bars and restaurants to close their dining rooms earlier this week, and that is, among other things, doing a lot of harm to businesses. Brandon Bates is live in downtown Winston-Salem with a distillery's new mission. Brandon, they're keeping their doors open, but also helping other people, right?
Yeah, that's exactly right, Kenny. People are still coming here tonight. Broad Branch Distillery here in downtown Winston-Salem, taking this unique approach. They are making their own hand sanitizer, and they are giving this away for free. As you probably noticed, hand sanitizer, one of many household items that are hard to come by amid the pandemic. Distillers here are burning alcohol off of grain they have, adding a little glycerin for texture purposes, and then they're bottling it up. Joe Tappy has been hard at work with his team since yesterday. He says their phones have been ringing off the hook, and people continue to pour in.
Oh, it's crazy. We're incredibly busy, and people have been outpouring of folks calling saying, hey, can we help? Can we donate something? Hanes Brands came by, wrote a $1,000 check. We've got, everyone's putting 20s and 100s in the jar.
Broad Branch is asking that you leave a donation if possible, and that money is going to the Lynn H. Berry School Buddies Fund. That goes to students and families in need. Distillers here say that the way they're making this sanitizer isn't necessarily hurting their bottom line. They would typically throw these ingredients away anyways. Now, this hand sanitizer made from malt whiskey, so it does have a smell of whiskey, but once you put it on and it dries, that smell does go away. Reporting live in Winston-Salem tonight, Brandon Bates, WXII 12 News.